and welcome to another podcast episode. This podcast is sponsored by Maarga Mind Care. When it comes to mental health, we often hear people saying, take care of your mental health. But how many of them do you think actually know how to take care and what struggling looks like in everyday life? In this episode, we go beyond the surface to talk about the hidden signs. Joining us today is Dr. Girishchandra B G, Senior Consultant, Medical Director, Psychiatrist at Maarga Mind Care. Hello, Doctor. Welcome.
Many thanks for inviting me today for your studio. I'm very happy. I'm very pleased to be here today. So this helps us in taking mental health message to the bigger, wider community. I'm very thankful for you to conducting this.
Sure, Doctor. So we shall continue this work of spreading awareness about mental health. We often hear people telling, take care of mental health. How should one take care? Now, that's the big question.
Yeah. See, we are very comfortable talking about diabetes, hypertension, heart problems and things like that. But we, the moment it comes to mental health, we start whispering. We don't really talk it out loud.
Yeah.
That's one issue we have. Many a times, certain issues are seen as, like, for example, if somebody is silent and they don't ask for help, that is seen as strength. If somebody is very, very aggressive and irritable, that is seen as attitude. So if somebody is answering the phone in the middle of the night and sending an email in the early morning, we see it as extremely productive, extremely driven. But is it really that the person is sending the message in the early morning? Is it because of being productive, or is it because they could not sleep properly? We really don't know what is happening there.
True.
So these are all the issues we have, which can, the problems can hide behind different labels. And so can come across as, okay, but somebody being extremely strong, somebody is being showing all kinds of attitude, somebody is being overproductive, but whereas they might be going through their own issues.
True.
So, okay, so always sadness or anxiety or being stressed not necessarily is the way the problems manifest. Sometimes it can come across as being tired all the time. It's exhaustion. So things they could easily do in the past, they are not able to manage anymore. They keep postponing stuff. They are unable to complete the tasks. The things that would make somebody happy, and so they were when they come, there would be life around them. Whereas now they come, they're constantly emotional. You touch them, you talk a little bit to them, they start crying and being over emotional. So these are also the way people, that means that they are having trouble with their mental health. So it's not necessarily that overtly sad and overtly feeling anxiety, but these can be. And sometimes even the mental health problems can also manifest as body aches and physical problems. So more than like how do we know that somebody is going through mental health related issues? It's like, no, it starts affecting their functioning, it starts affecting their performance. So that's when usually sort of, we know that they are having mental health related issues.
So once we identify, right, when someone realizes, like you said, when someone realizes that they need help, what are the steps that one should take?
One is realizing. How do they sort of, realize, that they're having a mental health issue? Once in a while, we all feel sad. Once in a while, we might feel a bit anxiety. But that's not necessarily that they're having a mental health problem. So it is when the problems persist for too long. Somebody is feeling for weeks and weeks, feeling very sad. It is when somebody's functioning is getting affected. Their work performance is getting affected, their relationships getting affected. So that is when we actually see that they are having mental health related problems. The intensity of the problems, the severity of the problems, when they start feeling guilt all the time, when they start feeling that they don't deserve to be alive, and when they start feeling that they don't deserve anything that's happening good in their life. And these are the kind of situations when actually they should be seeking help.
Okay.
How do you seek help?
Right.
So in normal circumstances, is it so easy to seek help? Do the employers, the HR, have they created an environment where it is easy to seek help? Families, do they make it easy for people to seek help? These are all the issues what we have. So fundamentally, the first step would be to talk about these things. So who is it we can talk to? Do we have family members who are much more willing to listen? Do we have that one colleague who is more open? Do we have that one friend who is non-judgmental? So these are the kind of situations we have to think about. And then at least when we start talking, when we start putting words to the emotions and feelings, that's when the first step would be. Like sometimes people these days also resort to social media, resort to sort of, chatbots, and so they're all helpful.
Right.
They do sort of point you towards the right direction most of the times. Sometimes you do have to seek professional help with mental health professionals like a psychiatrist or a psychologist. Like you go to them and you first consultation or so you seek with them. These days, you have to go physically. If you really want, you can also do a teleconsult, online consultation. First step would be to go and say, it might be a problem, it might not be a problem, but at least you are opening up. You are opening up in an environment which is non-judgmental, which is transparent, open about what you are going through, and they will be guiding you through if this is really a problem, and if it is a problem, where to seek help, what kind of help is needed, and those kind of questions can be addressed meaningfully there.
Okay. Now that you explained what the symptoms are and what steps should one take to, go to a consultant like you, what also happens is, doctor, we have also seen on social media, people speak a lot about it. Maybe they use these terms loosely.
Mm-hmm.
What is your take on it? Like, do you also see that people use this term very loosely without understanding the real meaning of it?
So people sometimes might use words a bit loosely, that I'm having this kind of issue, I'm depressed, I'm anxiety, I'm suffering from anxiety or whatever. But who are the people who are using social media these days? It is the new generation, and who are comfortable in using that. There are older generation also who are using, but they are mostly scrolling or mostly seeing what is happening. But the real use is done by the new generation. The new generation is also much more open from what we see about putting words to their emotions and expressing that and seeking help and telling their families that they do need help. So they're actually much more open about these problems. That's one. Second thing is that is it sometimes the words are used loosely? Yes, it does happen. It can happen. But what the words they might use, but what do they mean by those words? Now, somebody might say, I'm depressed. What exactly does it mean by that? So unless and until you explore that part, what is the meaning from their perspective when they say they are depressed, then only we can understand what exactly is happening. Are they giving some other meaning to the words what they are telling, and or are they really having mental health related issues? Is we get to know only when we explore those problems. So social media, you can talk about it, but you really want to explore, you really want to seek help, I think you need to get the help from the right place.
Okay. During our conversation, you also mentioned about family, seek help, support from family, but unfortunately, we live in a situation, at least few of them, where parents don't understand that, there is a need for any medical help when it comes to mental health. How do you convince them?
It is definitely mental health related matters. Still, there is a lot of stigma. And so there is this tendency to see the problems as, okay, you just don't feel that way. If you say that I'm feeling sad, why are you feeling sad? Don't feel sad. So, and then there's also this concept of walk it off, you just have to manage. Yeah, when you have a child, you are born to have a bit of a difficult time. So it's okay, everybody goes through that, everybody suffers. You also have to manage, you have to learn to manage, that kind of an attitude. And even like, for example, if somebody is going through separation or somebody has lost nearest family member, so it is seen as it's common, that's the way you're supposed to. And so, but when that's the way you're supposed to, when does it actually become a mental health problem? Again, it comes back to the duration of the problem. It comes back to the intensity of the problems. It comes back to the severity of the problems and how badly it's affecting the person. Coming to the family members themselves, the older generation are used to suffering silently, and they might come from that perspective and say that, okay, that's the way you're supposed to feel. That's okay. You just manage it. But suffering has been seen as a great strength in the past, but not necessarily. You don't deserve to suffer.
Absolutely.
Nobody deserves to suffer. So you should be able to overcome the suffering, put up some kind of a structure to be able to manage that, and so seek help, establish the right kind of support system so that you don't have to suffer. You don't have to go through the dark emotions what you are going through. So you can come out of it. So there is that tendency, there is that feeling that you just have to manage. But the new generation, they understand mental health related problems much better than the older generation. They are much more open about seeking help.
Doctor, also, can someone like very cheerful, vibrant person, successful in life, right? They're happy, they look happy always. How do these people identify there is an issue? Or what are the signs in such kind of people to identify, okay, they need help, or self-realization also, both ways?
See, if the one of the part of the question is that is it possible for a person who is extremely successful comes across as happy and
can go through mental challenges? Yeah.
So yes, absolutely, it is possible, and we see the examples all around us. People who are having issues with mental health. We have heard extremely fit sports people who have told that they are going through these mental health related problems. We have seen highly successful media stars and movie stars who have openly expressed. We have heard about movie stars who delivered babies and talked about postpartum depression and what they went through. We have seen the best of best in every aspect. So whether they are rich or poor or successful or not, so any one of us can experience the mental health related problems. What happens is these people who are successful, where they have issues is because they are seen as successful, because they are seen as managing the problems much better than the others. There is that additional pressure on themselves, additional stress on themselves that they have to keep managing that way. So in many a times, by the time they seek help, their suffering has been going on for too long, and the problems have got much worse. And so there is a delay in seeking help in people who come across as extremely successful, but they are going through mental health related problems.
How do we identify that, doctor?
It comes down to the same kind of issues what we spoke about. One is it is starting to affect their functioning, their biological functioning, for example. What we mean by biological functioning, it is they are not able to sleep properly, or they are sleeping excessively, their appetite is going haywire, they are losing too much weight, or some small percentage of people their appetite can, like for example, comfort eating leads to too much of weight gain. And so if they already have a medical condition, that can start the symptoms of medical conditions can start worsening. So any one of these kind of symptoms can appear with respect to biological. Then comes the social aspect, where they have started their interaction with people has started going down. They are not coming out, they are not mingling with people, they are avoiding functions, they are avoiding social interactions. That is with respect to social functioning. It can also manifest at workplace, like how they would deal with people and the subordinates, how they would interact with, and those kind of things also can get affected. When it starts affecting all these aspects of functioning, is definitely says that you need to seek help.
Okay.
And also, if it really starts affecting to the extent where you start feeling you don't deserve, and your self-worth is very not good, and you start frequently experiencing thoughts of wanting to end life, or those are the kind of situations which say that you should seek help, whether they are successful or not. These are the kind of problems they can experience.
Okay. Also in society, there's this thing, doctor, a person who wants to take me time, probably sleep a little, they label it as laziness, like you said, right? Speaks, then they call it attitude. How to balance this out?
What we are talking about is how is somebody seeing us, like how we are doing and what we are doing. So there is no way we can actually control what other person is going to think about us. We just have to manage what we are good at and how we manage our issues. But where we have to seek help or where we have to address this problem is this particular behavior of theirs is not natural to them. They were not like this before. Somebody was like, they have been, you're seeing them, the colleague of yours who have been with you for 2 years, and they have been really well adjusted, doing well with everyone, and suddenly they start becoming or showing different sort of signs now, and then you talk to them and they break down crying, or they're coming across as extremely anxious, worrying about every little thing that's happening around them. So if you see something different to their how they have been behaving all these days and how they're behaving now, that's probably when you see that, okay, this is not normal for them.
Okay.
Yeah.
We spoke about anxiety. We spoke about how people are using terms, loosely, or even they are serious, subtle symptoms, right? Doctor, we are almost at the end of the show. I want to understand, if you had to give 3 powerful tips or steps, whatever you could call it, by doing this, mental health will be like super fine. What would that be?
The first thing I would say is that don't, at any sort of situations, whatever the circumstances are, don't ever compromise on your sleep. Okay? As 24 hours, whatever we have, we need 6 to 8 hours of sleep. We just have to absolutely, without compromise, protect our sleep. Okay? That's number one. Second thing is, we should always have that one person or some social network around us, social support system around us, where we feel comfortable about talking about any kind of issues what we are going through. Most of us do have people who are mentors, who are good listeners among our colleagues, or one person in that family who is more willing. So those people, and if you don't have those things, I think we need to start developing them. So that is the second thing I would say. The third thing is that it's also about practicing to say things. Like, doesn't come easy to say I'm anxious, because you have never been allowed to use that term. You've never been allowed to use that term that I'm feeling sad. So it's okay. Sometimes we have to practice putting words to this emotion. Sometimes we have to say, okay, I'm feeling this way. I'm feeling, I'm struggling. So to say I'm struggling is hard. It doesn't mean that suddenly you've become weak. This whole concept of strength and weakness we need to overcome. End of the day, we should not forget we are human beings. We are biological people. So we do experience things differently at different points in time. So it's okay to feel low once in a while. So, but no harm or it's not shame to ask for help. So that's what I would say.
Okay. It's okay not to be okay sometimes is what you're trying to tell. That's a lot of information that you shared. That was really, really helpful. Thank you so much.
Thank you very much.